respectful. So welcome everyone. People will probably be joining us as we go along. So those who are on time, you will get the full on. So welcome to our webinar today, which is on how reporting and member outreach work hand in hand to really create that experience for your employers and for the employees. And you will also get to see how data flowing to the employer when it comes to insights also is valuable to the member, to pass that to the member and to get them to do the right things. So that's really the topic today. I'm one of the speakers, Ramesh Kumar, co-founder and CEO of Zakipoint Health. One thing that I get really excited about, how data can bring meaning to helping us save on healthcare costs. So that's a little bit about me, and over to my other co-speaker, Brian.
Good afternoon. My name is Brian Cavallo. I'm with UltraBenefits. We are a third-party administrator for self-funded health plans, and I am Vice President of Sales. I'm happy to join Ramesh and his team at Zakipoint, and I look forward to discussing how meaningful data really does help employers and your clients engage their members and really follow the trail of dollars being spent on claims. So we kind of look forward to jumping in on that and showcasing really the power behind the reporting and the data that is available.
Sounds great. Well, I know we have quite a lot of registrants today and hopefully participants. We want to make this interactive. So a few housekeeping things. Please, if you want to share your email with the wider group, feel free to drop it in the chat session. And two, along the way, if you have questions, please drop them in the chat session. We have a moderator, Dipali, who will be actually bringing it to us so that we are either answering them throughout or certainly towards the end. Three, I wanted to just kick it off with a poll. So those who are already on it, I want to make sure that we are listening to you. Oops. Great, so you should have a poll on your screen right now. I'll give everyone about maybe a couple of minutes to really think about this. What do you want us to talk about today? The options are what should be in the reporting and analytics kind of system. Option two is examples of actions or what specific things you can do to manage risks and costs. So we can dig deeper into that, looking at potential savings and that kind of stuff. Three is a good member experience that takes the data and drives it at a member level. Four is we could focus a lot more on case studies or if there's any other kind of things that you like to include here. So if you can respond to that, you've got another minute and a half. Please, we'll get maximum participation. I want to really make it relevant for all of you. The numbers are ticking a little bit. We've got something in the lead here. We've got a couple of them in the lead. What should be in the reporting and analytics system and actions that you can drive. So 1 and 2 is in the lead at the moment. Nothing for a good member experience, but that horse is actually way behind. All right, 30 more seconds. Get your input here quickly. I'm seeing some more questions. What type of info TPAs can share without exposing the employee from confidentiality perspective? So that will be covered in the member experience side of things as well. So obviously in the reporting, we will talk a little bit, but at a member level as well. So we're going to end the poll in 10 seconds. At the moment, the lead, 43% of you have said what should be in the reporting and analytics. Anyone wants to change that? Any other horses that are going to go over the finish line here? 5, 4, 3, 2, 1, end. All right, so let's share the results. So we're going to talk a lot more about what should be in the reporting and analytics, and then followed by actions that you can take. So those two things we'll certainly talk a lot about today then, and then case studies. So let's kind of, we'll adjust the agenda accordingly now. So let's kind of dig into this with this How do I now? Let's see. Mhm. Okay. Sorry, let me pass it over to Brian. Why don't you kick it off with this?
Sure, thanks. Thanks, Ramesh. Thank you, everybody, for joining. As I stated earlier, I want to thank Ramesh and the team at Zakipoint for inviting UltraBenefits here on this call and really kind of explaining and going over how UltraBenefits has leveraged the IACT model or process within the Zakipoint reporting. We engaged a little over a year ago Zakipoint on for several different reasons. We were using another utilization reporting tool that really just did not deliver what we needed, what we really needed, or our clients were looking for, frankly, in our consultants. So we started out on a journey, and we reviewed and researched several different platforms, and really kind of settled in on Zakipoint and Ramesh and his team. And one of the things that really stood out amongst all the other platforms that are out there is the ability to engage the members all under one roof, so to speak. And that's what really impressed us the most. Like I said, we looked at all sorts of analytic tools, and yes, they were able to identify data. Yes, they gave you some low-level actionable items that you could partake of. But really, where they kind of fell off the cliff was that next step. Okay, great. We've got data, we've got actionable items, but what do we do with it all? And frankly, that's where many of the platforms out there they missed. They swung and missed. So, we'll talk a little bit about that engagement and really the Z-Connect model, or the Z-Connect, I should say, platform that really turned us on in choosing Zakipoint. So, like I said, over a year ago, we engaged with Zakipoint, brought them aboard. We completed the launch of our visual dashboard and reporting across all employers. We did this in record time. We had it up and running about a 10-day time span, pushing all the data from UltraBenefits over to Zakipoint, eligibility files, claim files, and of the sort. And then within launch time, we were able to deliver our first reports to customers within 20 days. That was an incredible speed to market. We were really impressed how Zakipoint was able to handle that and deliver what our clients really have been looking for quite some time. Now, our use of the IACT, it now provides us with reports that are able to capture baseline and quarterly insights along with clinical reports, which is really critical. The vast library of clinical recommendations that is within the IACT model is really unparalleled. I have not come across any other analytic tools that really drive home clinical recommendations and clinical reporting like we do here through the IACT model, which is why UltraBenefits uses that along with its consultants and clients. We were able to provide custom analysis of flexible cohorts. You'll hear that term used a lot here today. Stop loss negotiations, obviously, is another factor that we take a peek at and are able to customize. Network utilization, impact modeling from the campaigns that we're able to create within IACT, provider analysis, and obviously high-cost claimants. We also were able to add on a couple of tools that come with the IACT model, which is Z Navigator and Z Connect. These are critical to the process of engaging members and driving down claim costs. Frankly, that's what we are here to do. As a vice president of sales at UltraBenefits, my #1 goal is to work with consultants and clients to drive down claim costs. I believe that is the ultimate goal of any employer really entering into a self-funded health plan. Z Navigator really is that member management portal whereby medical management team engages the population at a member level. How many times have we sat across the table from C-suites and HR and basically say, hey, listen, we've got a great plan, and you beg them for their buy-in, And without their buy-in or without their promotion, sometimes engagement campaigns really go nowhere. We've cut to the chase. We get right to the member level, and we start engaging and working with members directly. And ZConnect is the actual mobile app that helps us drive that engagement. So that ultimately we see the outcome of the campaigns that we're delivering. Next slide. So what I want to do is I want to kind of walk you through the IACT model. Identify, act, connect, track. It's basically what that stands for. And it helps us manage the risk and cost of each of our clients and really helps the consultants to sit down with their clients. We sit with our consultants and clients at a minimum on a quarterly basis, and brings meaning to to basically the decision that they've made to self-fund. So in the first instance, under identify, these are some of the things that the data that is within the system via claims that we're able to look at and kind of parse out and focus in on and really take them out of context and make them a pretext to what we want to deliver with our clients and consultants. Obviously, we see a lot of overuse in the emergency room. I think all of us here on this call talk about that probably constantly with our clients and how that drives up cost, and really trying to put in programs that changes that behavior. More in depth are poorly managed chronic conditions. We see that so often within the claims data, where you have minimal claims coming in, but something is not taking care of their condition, and ultimately they end up on a high-cost claim list, which leads us to mismanaged high-cost claims. Obviously, we were able to identify increased spend on RX benefits. We're really able to take a look at low member engagement, which we feel is the critical piece that helps lower the overall claim spend on behalf of employers. And then really inefficient service utilization. We can't tell you how often the data identifies really services that should be utilized, they're just not being utilized. And when we see that, we know time and time again, history proves what that leads to. It can lead to chronic conditions, high cost claims, and ultimately at the end of the day, increased claim costs for your employers. So once we're able to identify all of this data through the system, we then act on that. And what we're able to do is prioritize actions and campaigns that are very targeted, specific, and effective. It's critical to understand the specific and effective targeting of each of these, what I will call cohorts from here on out, and really work within those specific cohorts to obviously drive behavior. Obviously, some of the things that we recommend acting on, you drive up usage for mail order medication over retail. Are folks going to see their primary care physician on an annual basis? Is there opportunities to close gaps in care within each of these cohorts or conditional cost drivers? So we're able to look at that and help our consultants and clients close those gaps in care. The more we're able to close, the healthier the population becomes, the lower the claim spend becomes for our clients. Obviously, reduce unnecessary visits to ER. Obviously, recidivism within the emergency room leads to high cost care. And then promote appropriate places of care. We often see folks, frankly, not knowing where to go and really receiving. It could be the fact that they're going to see, having services done at a hospital outpatient setting. I think of infusion therapy. More often than not, that comes across my mind, and we see that quite a bit. We work with various cost containment vendors. One comes to mind, which is OptiMed. They do a fantastic job with us and our clients and consultants, taking infusion therapy out of the hospital outpatient setting and moving it into home infusion therapy. OptiMed is great to work with if you never have before. I'd love to talk to you about them some more. But they basically are able to source the drug for us, get the nurse, hire the nurse to go to the home to administer the drug in the comfort of their own home. And we've seen upwards of almost 50% reduction in those infusion therapy claims. So significant opportunities to save all over the place. It's just being targeted, specific, effective, and ultimately executing on those campaigns. Next slide, please.
So one question being raised by Michael about mail order, beyond mail order, do we do things like brand to generic? Yes. So we are identifying that as well and being able to promote generics where people are using branded drugs. There's a question by David Contorno as well, which is more about, do you take risk if you are doing all of this stuff? I don't know, Brian, if you want to tackle that question now.
Well, I gotta see let me look at the question here from Dave. Let's see.
Or we can come back to some of those bigger questions, which is really.
You paid in any way that aligns with lowering costs. That is a very, very good question, Dave. Off the top of my head, I cannot think of any way in which the TPA, I represent UltraBenefits, the third-party administrator, we're not incented in any way from the vendors that we work with to help lower costs on behalf of employer groups. I think that's a great question. That's not our philosophy. It's not our money. It's the employer's money. So I hope that was. I hope that answered the question there. But I definitely understand the direction you're going in and agree with it. We are not. So let's go on to let's go on to a couple of other pieces here under the IACT approach in helping employers manage risks, and then we'll go back to some of the questions that are out there as well. So we talked about identifying data, right? It stands out. It's pretty easy to kind of come in and like I said earlier, parse out various cohorts that are conditional cost drivers and take a look at them. We're able to do some actionable recommendations, being specific and targeted. So this is really where I think a lot of this differs from other tools that are out there, is the connect piece. The connect piece really is where we engage the members. We do that through proactive campaigns that are personalized, leveraging the data that is available to us. It's easy to use, the member interface that helps members across all stratums accessing information that they need. It's high touch, it's high tech, and there is a customer support team that has access to those insights that they can actually speak to the member and educate them on. So once we're able to create these campaigns, deploy these campaigns, monitor them through tracking, we're able to see if these are relevant and if they're personalized. Some work, some don't. Lack of engagement obviously leads to campaigns not working, but above all, are they relevant? Are they actually helping drive down the cost of care? And really, that's the end game here, is to ensure that costs are going down within each specific cohort that we're able to identify. And then we set goals and we track the progress. We meet with our consultants and our clients, and we're able to track and monitor the success of our campaigns that we're doing. So here we have just kind of a little bit of a meeting that we had. It is a client of UltraBenefits. It's a hospital employer. I'm just going to kind of go through the IACT model that we took this employer through along with their consultant, and just share with you some of the information that was revealed to us using this process. So through the identification process of IACT, we looked at a cost standpoint. 26% of the claims that were generated were obviously done by 19 members. So we all see this and we know this. It's less than 1% of the population, right? We typically see that on the majority of our utilization reports that we run, where there's just a few members generating the most amount of claims. Preventative services within this employer group, being a hospital, the preventative services had very, very low utilization with compliant rates over a 12-month calendar period. This was in 2020. So what did that look like? When we talk about preventative services and low utilization and compliance, what did that look like? Well, 8% of the members of that population received preventative care. This is a group of about 1,500. So that is really low. 7% of the members over the age of 40 received a lipid test. So what's that telling you? Folks aren't seeing their primary care. They're not doing their annual physical, which when a lipid test is done, which is going to lead to obviously some probably difficult conditions on the horizon if the general preventative services to keep you healthy are not, excuse me, are not being accessed. 9% of women ages 21 to 64 receive a cervical cancer screening, very low. 13% of members ages 50 to 75 received a colorectal screening. These are not good numbers. We all know this, but without knowing that data and without being able to discover that or identify that, there's really no way to work with the consultant and client to explain to them, hey, listen, if we don't really focus in on these areas and get better performance and increase our compliance rates, it's only going to lead to worse. And really that worse is in the form of higher claim dollars. The three most costly conditions for this employer at the time, what we refer to as cohorts here, were diabetes, osteoarthritis, and hypertension. All three of those cohorts were, could become, the health and the cost could be impacted positively because of any with lifestyle modifications. So we're able to identify that as well. 90% of ER costs were driven by conditions that didn't require the ER visit. That's something that's very common. And then for pharmacy, there was potential savings for members who use brand medication when generics are available. For that period, the potential savings was about $50,000. So one of the things quickly that the IAC model does through Zakipoint is it gauges all of these different services that should be done based on the condition. And it will actually share with you the potential savings within each of those cohorts if the clinical recommendations are followed. If they're not, obviously the savings are wasted. So what did we do with this employer group? We created a targeted wellness program. You can call it wellness program for these three specific cohorts of diabetes, osteoarthritis, and hypertension. There was a discussion with the consultant of changing the ER benefit to discourage overuse, probably a commonly used practice among consultants when it comes to that. But we really laid a large focus on preventative care. We helped the consultant and the client adopt a campaign called It All Starts With Your PCP, and really encouraged the members within the group to start utilizing preventative services through their primary care. So we put these campaigns together, we tracked them, we looked at the impact of wellness on diabetes, osteoarthritis, and hypertension. We looked at and monitored the ER usage for chronic conditions. We often talk about appropriate place of care. Certainly the emergency room is not an appropriate place of care for chronic conditions. We looked for increased compliance with preventative care services. And obviously we took a look at the increased utilization of low-cost mail-order drugs. So we were able to track those successfully with our client. And over that period of time, we did see a 6% reduction in claim costs aggregately across those three cohorts. While that might seem low from a group that size with the claim dollars that they spend, that equates to a lot of money at the end of the day. Next slide. So cohort engagement. This is one of the things that I personally sit down with many consultants and work through with them and their clients. Really taking a look at those conditional cost drivers, who it is within your population that falls into these buckets, so to speak, and what can we do together to obviously change the behavior within those cohorts so we have a positive outcome both from a health standpoint and a financial standpoint. So we identify cohorts with opportunities to save, which is a great tool within inside of Zakipoint. We then create a campaign, launch a campaign, and then we track a campaign. Just what we saw here prior through the IACT process. Next slide. So this is just an example of it. It's a small size group. Certainly 44 employees, 130 members total. So small, but really kind of was interesting. I was working with the consultant on this case, and one of the things that stood out to us from the prior reporting period to this reporting period was really, and we looked at the conditional cost drivers within the reporting system, and what stood out to us was this increase in hypertension. And the cost rose about 7% in total medical spend for the prior year. And one of the contributing factors was this condition of hypertension. First and foremost, 6 brand new members joined this cohort, so to speak, probably unfortunately, but nevertheless they did, which obviously led to a significant increase within this condition. The actual cost for the cohort itself was about $156,000. Using the predictive modeling tool within Zakipoint, it's going to ultimately be a predicted cost of about $200,000. This is stretched out amongst 22 members within that cohort. So we have data here in front of us. We're able to identify an unfortunate rise in cost within one of these conditions. So we have now able to identify a cohort. So if you look over here on the left-hand side of the navigation, you'll see that there is a tool called cohorts. When you select that and you work within this section of the system, if you can go to the next slide, Ramesh. This is really a very powerful tool that we like to use with a lot of our consultants. For this particular employer group, the consultant and I found about close to help manage in a better way. Now, some of those cohorts had no changes at all, and there was really no savings or potential savings, so to speak, within those cohorts, meaning those members were doing the right thing. They were taking care of themselves. They were doing all the clinical things that needed to be done in order to manage the risk. But then there are other ones that this reporting tool will highlight and show you that there's an opportunity for savings. So in this instance, we looked at hypertension in the prior slide. We identified that as a conditional cost driver. And here is a little bit of the utilization summary that is within this cohort. We saw a total spend increase of 77% to the tune of $139,000. That is a significant increase from the prior reporting period. Your PMPY went up 65%. That's never good to see. But above all, the risk score is now at 1.5. So there's a 20% increase in your risk score. This screams you're going in the wrong direction. And untreated or unmanaged, better said, it's only going to lead to further exasperated costs on behalf of the employer group. So what we are able to do is we are able to show you that there are potential savings within each of these cohorts. And then, and what we're going to see here on the next slide is you're able to take action. There's a take action button that you can click on, or there was a create the campaign. It's the same thing. Virtually what you are doing is you are taking action on this potential savings. Now here I know it says asthma management. We're just kind of showing you as a sample as to what can be done through the campaigns that you can create for really any particular cohort that the population may have. This one here, we just happen to be using an asthma management example here. But like hypertension, like asthma, diabetes, you name the condition, really what's being delivered here through this model is all the same. We have several recommendations that can be made through the reporting system. Number one, Ramesh is going to touch on this here in just a short minute, is really the Z-Connect, Asthma Management Program. So what we would do with the consultant and the client at UltraBenefits, and have done on many occasions, is we run a Z-Connect member outreach campaign, directing members to take actions to close the gaps in care. Again, this is done specifically to that cohort. It is targeted directly to them and communicated to them and them alone. And that is done through the Z-Connect app that Ramesh will be demoing here just shortly. Secondly, another recommendation, and again, this is where I work with a lot of consultants, it could be maybe an adjustment in plan design. Sometimes that really doesn't get you the impact that you need, but it obviously is a recommendation that can be made. And really third is the solution partner. This is where I think with Z-Connect and the solution partner can really make a difference in how spend goes. So we have various solution partners within UltraBenefits. One that I can think of and we use, and frankly, when any time a consultant places business with UltraBenefits, each client gets the use of our partnership with Accolade. Accolade is a concierge management program that we have been using for quite some time with them. And it really does an amazing job. When we want to deliver a particular campaign along with the Z-Connect mobile app, we're able to work with Accolade and do proactive outreaches to various cohorts within the population, where a health assistant can speak with them. If a health assistant recognizes something, they'll go ahead and get them off to a nurse case manager. And then really that nurse case manager will start to evaluate the appropriateness of care. Are they seeing the right provider? Not only from a quality standpoint, but from a cost standpoint. And we work with them, and we work with Accolade in many instances to help steer members to high quality, low cost providers. You think of all of the labs and the diagnostics that are done at health, in a hospital outpatient setting that are extremely expensive. Instead, they could just simply choose a freestanding lab or facility. Low hanging fruit, but major impact on claim spend. So, Accolade helps us perform that concierge management on behalf of all of our partners and consultants, and really does a great job. But really, it's, you name it, it's your, as a consultant, it's really your solution partner that you want to implement. UltraBenefits is more than happy to recommend many different solutions that we have. I can think of orthopedic surgery and the partnership with Regenex that we have, which is a great idea. We often have a whole host of organizations that we work with from a centers of excellence standpoint, again, which is another great solution. So the list can go on and on and on. And what the system is able to do here within this campaign is to really let you know the number of members that are eligible, and then ultimately predict the return on the investment. So if you X, it's going to equal Y. And that really is what's important to see, is the time, effort, and treasure, really, of our employer groups that they invest within these campaigns, is it delivering something back? And that delivering something back really needs to be in the form of lower cost. Because as I stated earlier at the beginning of my conversation, that is truly what I believe is the decision employers made when they chose to self-fund. So I think we can go to the next slide here.
So
if I'm not mistaken, I'm going to turn this over to Ramesh.
Sure. Was there a question from the audience? No. So just to kind of take it forward, Brian, you did a great job of how data is used to identify how to create actions, whether that's a campaign or incentive or a program or plan design change, or even a third-party program. How do you, at the end of the day, turn that into a member connection, member experience? I'm not going to go through the full demo, because I think in the poll we heard you guys want to hear a lot more about case studies and how to leverage the data. So I'm going to cut short this part of the presentation to really just give you an overview of what Connect is all about. It's a mobile app member experience. Basically, at the end of the day, people don't want to be communicated to. When you say, look, I want to do a campaign, a member is not sitting there and waiting for you to just communicate with them in the middle of dinner with their family. But what people do want is the ability to connect with their healthcare. And that is really fundamental to what consumers in healthcare want. And so what we try to do with this member experience is really to be able to provide that basic administrative support that could be things like accessing ID cards, plan design data, deductible, real-time deductible position in terms of where you are on your plan, and where have you gone for care in the past, being able to quickly access a lot of that stuff, and claim status and stuff like that. So really at the fingertip for them, accessing a lot of those administrative tools and data and information, and actually supporting them 24/7 through an artificial intelligence kind of chatbot, which basically answers their questions related to plan design, to claim status, to particular provider, or so on and so forth. And it really takes it to the next level of this accessing the accessing care aspect, the provider search aspect. Who are the providers in my network, or what are the nearest places based on where I am right now. So making it very easy to do the provider search. And then on top of that, being able to provide these campaigns that Brian talked a lot about. How do you personalize these campaigns? How do you deliver that personalized experience, which is more about once you connect with the member, you're giving them that guidance, that nudge. So these campaigns can look something like that you see on the graphic over here. Next time you need care urgently, consider using an urgent care facility instead of ER. It will save you time and money. Click here, and it actually opens up the 2 or 3 urgent care places nearby to that individual. Or I think there was a question raised about mail order medication or brand to generic. So members who are identified, they receive a campaign like save on your deductible by using maintenance mail order medication program. Click here, and it tells them here are the 3 meds that are available to you for mail order. Click here to kind of purchase on the mail order program. So that's how we are delivering this personalized experience. And then where it becomes beyond the ability of a digital assistant, we are effectively connecting that member to a customer support or member services team, or if there's a clinical team available, to be able to connect them to the clinical team. So those are kind of 4 different layers of how we are supporting a member and achieving a much higher level of engagement, much higher level of personalization, really leveraging the same healthcare data that is coming through your systems or is available. How do we make it available to the member as well? So that's really what the Connect piece is all about. If there's more interest, drop us a quick message in the chat, and we'll be happy to follow up and send you a bit more information on how this is actually what this experience looks like. So I don't want to take up time for everyone else. So that means Connect. Let me just share with you just a couple of more case studies that might bring this point home of how identification and actions with a communication can actually result in impact. So this is an employer that was about 400 or 500 employee lives, had multiple chronic conditions, somewhere in the Midwest region, and they had high risk population. Once we identified a cohort of people, we sent out a personalized communication, the campaigns that you saw through text and email, and with an ability for them to speak to a clinical team member, a nurse navigator on the back end. From the identified people, we were able to get 2/3 of the people to either close all the gaps or 1 care gap. So this was a phenomenal result. When you're identifying people, you're getting 2/3 of them, because it's relevant to them, we're getting them to take that action. So that's really the kind of impact that you can have if you are making it relevant and personalized, and it actually translates into dollar savings as well. Let's take another example where a cohort of people that were identified for a different employer group, where there was a mail order pharmacy was being offered but was not being really used by many, and people were unaware of it partly, and sometimes their specific medication may or may not be available or not. So once we identified there was a personalized communication being done, which I think you saw a campaign example of that, and we saw overall 60% engagement rate. So all the people who were identified, there were about 60% that actually engaged in the campaign and moved to a lower cost mail order option. So a pretty profound action rate once we engaged the population, because there was a clear saving, it was convenient, and this is actually something that seems to, when you make it specific, when you make it relevant, and you give them an action that they can take by clicking and doing that, you get much higher response rates and better behavioral change. So there's a couple of other examples. Please, feel free to fire some more questions over here, because we're going to be wrapping up pretty soon. Before we actually wrap up questions, we do have one for those who are still remaining here, 40 of you. There is an offer coming up. We will be offering for those who are sticking around. So, but before we move to that, any additional questions? COVID vaccinations and things like that. Yes, so interestingly, one of the big things is, where are the COVID centers? What is some of the, how many people are affected by COVID? So there's a lot of that type of work where we've done two types of things. One is being able to identify the population that has had COVID based on the claims, and then what is the impact on the employer of COVID. So that's one big area of work that we've done. The other is being able to promote to the members where the COVID testing places are, or statistics or other kind of things, to really provide some of that education and content to the members. Excellent. So let's move to the offer for those who have stuck around. So Brian, pitch in as well. Let me just quickly summarize. We are happy working with UltraBenefits for the brokers who are out there to offer to do one diagnostic insight report, which is what you can see a sample of that. Follows the same identify, act, track components. You'll have to provide the data. Once we receive the data, 4 weeks later, we can provide this diagnostic insight report and access to the dashboard, so you can see yourself and drill down yourself some of those visual stories that Brian kind of took you through. What we need is medical claims, pharmacy claims, eligibility file provided to us by a cutoff date, and also a clear articulation of, if this free pilot, what is the goal of this? What is the result that you are looking for? If that is achieved, then you will move to working with us. So a clear articulation obviously doesn't mean that you will have to, but it's more like just to have clarity around that. So that's really the offer for the participants here today. And please drop your email addresses in the chat session now if you want to avail this opportunity. Anything else, Brian, to add to this?
No, I think it's a good opportunity to kind of really evaluate at this point in time, what is it that you're using? How often are you meeting with your clients to go over utilization, particularly quarterly? And really, what are some of the questions that your clients are asking you? Is the current platform that you're using falling short and not being able to really, what I would say, under one setting, be able to take a holistic approach, so to speak, and drive down those costs as we've been talking about here throughout the day. And obviously looking at the opportunity to do it through the IACT model, right? Identifying data, acting on the data, connecting, which I think is critical through member engagement, both through the ZConnect app, as well as some of the services that we offer through UltraBenefits, namely Accolade and also other vendors, to really help you achieve those goals that your client is looking for. So, Ramesh and I really, we'd encourage you to take us up on our free offer, so to speak, and let's deliver you a diagnostic insight report, sit down with you, go over it, because remember at the beginning of this, it has to be meaningful. And that was really the underlying reason why Ramesh and I want to do this, because it's got to be meaningful to you and to your client. It can't just be another spreadsheet of claims data with little to no action at the end of the day. So I want to thank you guys for your time. Ramesh, I don't know if you have any closing words here, but very, very happy to have an opportunity to speak with everybody here today.
Yeah, no, same here. Thank you for your attention and some great questions that have been raised so far. But obviously our contact information is here. Happy to respond to any of your additional questions that you weren't able to ask on this forum. And thank you, everyone. And please, even if you are a TPA and you wanted to avail some of that, the offer itself for a group or so, happy to kind of support you. Thank you again, and until next time.